We're live from Tijuana, Mexico. Okay, here we are. I'm with
Kelly.
Say Kelly. Okay, good. Yes. Okay. It's fun because did you ever see old Saturday Night Live?
It's been a while, yeah.
Okay. They'd say, "Hi, I'm with State Your Name." No. Okay. So, what brought you down to Tijuana, Mexico?
The very first time I came down was for the dental, and do I describe all of that or
No, because I mean, you're down here at the clinic. We've got holistic dental care. We've got IVs. We've got minor surgery center. We've got the corrective chiropractic. And where'd you come from?
At the time, I was in France, and I was very sick, and I knew that nobody can solve my problem over there, and I knew I had a lot of root canals, and that was probably the source of my issues. And the funny thing is that I wanted to go to a chiropractor, and I said, you know what?
Cool.
I'm not going to go to any chiropractor. I'm going to go to this person that I've been watching on TV, Dr. Bergman. And then I discovered, ironically, that you had opened an office here as well, and that was so bizarre.
Yeah, with the dental care. Because do you know why? Multiple sclerosis, anxiety, stress, depression. Everybody's got these chemical stressors, or not everybody, but a good hunk of them.
Yeah.
That's why. I met Alessandro 25 years ago.
Yeah, and I saw your video that you were going down to here to get dental work, and so at some point I would see you. It didn't happen at the beginning, but it happened just recently. So, yeah.
Cool. Did you have any trouble? Because I know now you're living north of the border, not in France, or are you still traveling back and forth?
I don't really live anywhere. I'm a nomad. I'm living in a van right now.
Okay. So how many people, raise your hand, unless you're driving, would like to live in a van? Oh, God, yes. I'm trying to get my sweetheart to move on a boat. Okay.
Yeah, well, that's the next step. I'm taking sailing classes right now.
Okay. If you're going by San Pedro Saturday or Sunday, stop by.
Okay, yeah, I've seen your videos.
Well, get the information from Sarah. Okay, because you'll actually take it.
Yeah.
So now, what did you have a good experience at the dental stuff?
I was at the experience where it was time to do, I did 7 extractions, 7 root canals, but they missed one, so they weren't, so I was like, but I'd rather they miss one than take one away. But I had 7 done all at one time, and I got to the point where I was finally ready. I did everything I could on my own. I got myself in an okay health position, and I was ready to do it all and just get it out of my body. And the experience was shockingly impressive. I wasn't expecting it because I had done the root canals before. The wisdom teeth. And so, you have the inflammation afterwards. Oh, that's normal, haha. But this time I had no inflammation.
I know. Isn't that a trip? And no pain.
No pain, no inflammation. I didn't take any pain medication. I didn't take any anti-inflammatory. I didn't even do the antibiotic afterwards.
Okay, the crazy thing is that by law they got to give a pain reliever and antibiotic, but when you're doing the vitamin C IV, then they do the plasma cell. When they do the extraction, they do it correctly. They go back in and remove the ligament that was holding the tooth. That way you don't get the cavitation. Then they take your blood, spin it down a plasma cell, inject the opening so you don't have the the open hole system syndrome or whatever the heck it's called.
Cavitation, yeah.
I mean, none of that stuff happens. And then you're getting a vitamin C IV during the process.
Yes.
I know.
And then I woke up and they had already put in the temporary denture to also reduce the inflammation. And they wheeled me up to my room upstairs, and I looked at my face and I could smile and I looked like nothing had happened. I felt like nothing happened.
Isn't that a trip?
That was so bizarre to me. And
okay, did you notice some positive physiology too?
So I had a lot of skin stuff. It was exposing itself to the skin. I had fatigue before, so I had inflammation, just chronic inflammation for about 1.5 years. And I had done like hot yoga to sweat it out. I had done herbal stuff. I had done fasting. I'd done all these things to prepare myself, because actually it really was preparing myself. It wasn't completely healing. And so I was hoping for all the skin would be gone. Everything would be perfect afterwards. And so then I realized, okay, this takes time. It took time to get to this point. So it's got to take time to heal. And I had an abscess And they didn't do bone grafting, but it was bad. And I had previously had an abscess here, which scared me.
Oh, yeah.
And I knew that, okay, maybe it could have been worse if I wasn't in such a good shape before, if I wasn't an athlete, that maybe that could have been really bad. So that was maybe a month before I had it done. And so I knew I was my lymphatic system was in a bad state. And I had gone back 4 months after to see if this had healed, and they said it still needs to heal. And then I came back a couple months later, and then I realized, wait, the skin wounds that weren't healing, and especially I had one on the right side, my hand, which I had learned that it was connected. Just the skin was not healing, the whole entire skin. I had to wrap it. People thought I was a burnt victim, and so I was a victim of something else. But then I realized, when this healed, that healed.
Isn't that a trip? Yeah.
Yeah.
So few people can get that correlation of the toxicity in here and how it affects the entire body.
Mm-hmm.
Thank God.
And also, I had inflammation in my ankles. I actually really couldn't walk that far without inflammation. I had to put my feet up. And I'm an athlete. I'm a coach. I used to run circles around my players who were younger. And here, I can't even walk for very long before inflammation. This is bizarre until, I got my teeth worked on.
Isn't that a trip? And that's one of the things that is so commonly missed. People do not look at dental health or think that cavitation or abscess up here could affect the entire body. Did you find this in research or?
I did a lot of research.
Okay, totally cool.
I was fortunate that I wasn't working at the time, but also I really couldn't work because I'm an athlete, I'm a coach, I have to be active. I was sleeping 12 hours and this is not normal. So I did a lot of research and I looked at Dr. Weston Price, Dr. Hal Huggins, Dr. Thomas Levy, and so they were really talking about the root canals. And so when I found this place, I forget who I discovered it through, but they did the Huggins protocol, and that was what I wanted. And I wanted the cone beam X-ray, the 3D cone beam X-ray to look deeper. And so I didn't want a superficial diagnosis. I went to some doctors in France and also here, or in California, and they just want to give you like prednisone or corticosteroid. And I'm like, are you serious? I've got my whole I'm red everywhere. You want me to put this on my entire body? Like, that's scary to me. And they're like, be very careful. And I'm like, I don't know. I'm not going to do it.
Okay, so because you're listening to these doctors. I doubt if the medical doctors are saying, wow, I'll bet you have a cavitation or some type of root canals. What drove you to that further research to finding the problem? I know being an athlete, you're used to having your body work at a high level. Yeah. So my studies were in kinesiology, exercise science, so I have that background. So I'm working with athletes, but I'm not working on the cellular level anymore, so it's been a while since but I know many things still. And I work with athletic trainers, my athletes, and I work with them, and they're working on trying to get you back on the field, not rest for 4 to 6 weeks. They want you back on the field. So it was always that mentality that I've been around. And going to regular doctors, I never really went to them. And then, so I'm going there and I'm thinking, you're comparing me to somebody that is really unhealthy, and I'm an athlete. I perform at a high level, and I want to be at a high level. I don't want to be just average. I don't do all these things. I surf and I don't know. So I knew that there was something more, and it's not that I'm missing more steroids. I'm strong enough, and I don't need something on my skin. So just being at my best self. That's one of the ways that we look at it, because to identify if a cavitation or root canal or something is negatively affecting you, we do a full body thermography and lymph the whole face and mouth drain to the upper chest on the right. So if we see that, obviously it's going to be negatively affecting. What can you tell? Because I see that as a contributing factor in about half of my fibromyalgia patients, a majority of the chronic fatigue patients. The multiple sclerosis patients, about 30%, all have dental toxicities as a chemical stressor. Now, what could you tell people with those kind of diagnoses? I want to just find the cause.
Yeah.
Okay?
Yeah.
It drives me nuts because they'll say, oh, I've had it for years. And, you're taking the steroids and antidepressants and
I wasn't doing it. But
okay, so talk to the people out there that got this systemic skin disorder, the joint pain, the swelling, all the list of diagnoses that you could have been labeled with.
Yeah.
Okay? What would you tell them? I'd say find the friggin' problem.
Oh, yeah. Well, there was also a documentary called Root Cause. I don't think it was done the best way, but it was hilarious because I'm like, yeah, that's me. Like, the guy was a surfer and he had one root canal and his health was deteriorating and he was doing all these different things. And I'm like, that's really funny. I've done all those things as well. And I kept hearing Dr. McCullough in my head that I heard him 10 years before. Those root canals are going to catch up to you. You might be healthy, you might be fine, but one day. And I was like, God, I know it's that one day, but please, I don't want to do all this. I've invested so much. And then it finally got to the point, I'm like, I'm not living. I'm not enjoying life. I'm sitting at home and I don't want to talk to people. And I'm a social person. And I couldn't wear clothes. Like, my skin was itchy. It was horrible. I was embarrassed. And this is not me.
Thank you, God, for having the strength, but that's why you're good at what you do.
I'm a fighter and a survivor. We won't talk about that. But.
So if you're suffering, if you think you're optimal healthy, double check your health. Find the cause. Find the cause of the suffering. Your body gives symptoms for a reason. Find the reason. What we do is the live blood cell analysis, full body thermography, nerve scans, X-rays, the digital X-rays of the mouth, the CBC or complete blood cell count. If there's a better way to find something, let me know and I'll do the test. Okay, if you can't make it to Tijuana, Mexico, find somebody that can do similar work. Huggins protocol, somebody that takes an X-ray or does this test and does a post one to document that they actually fix the problem. Get out there, find the solution, and this is real people, real problems, and real solutions. You rock, kind.
Thank you.